Welcome to the Sisters Network Leadership and Survivorship virtual conference series. We're continuing it through 2021. This is I think our fourth session. My name is Colleen Allen. I am the Vice President of Sisters Network Incorporated, and we are very pleased today to bring you a wonderful and important topic, new advocacy strategies for engaging the Black community in the digital age. As we all know and learned through COVID, we really rely on the digital devices, whether it's Zoom or our mobile phones or what have you, to communicate, engage, and now more than ever, I think we will continue to incorporate the digital factor into our engagement practices. I know Sisters has been very successful with it as well as some of our peers. So we're very excited today. Hello to our Facebook Live friends who are watching today. But we're excited to have this conversation, and I'll introduce our speaker in just a moment, but let me just first thank our generous supporters who make all of our efforts possible. We can't thank our sponsors enough, and that's Pfizer, who is our Pink Ambassador sponsor, as well as CGen, and then our Pink supporter is ASI. We are very, very grateful to these organizations, these corporations rather, who not only have supported this leadership and survivorship virtual conference series, but also Sisters Network in general, other outreach efforts that we have had throughout the entire year. And so we, again, can't do it without the support of our corporate partners and friends. So without further ado, let's talk about new advocacy strategies for engaging the Black community in the digital age. We have a dynamic woman who is a leader and an expert in engaging in equity and that kind of conversation in that space. She's also a board member of Sisters Network, and we're very pleased and grateful to have her join Sisters Network, and looking forward to her leadership and insight to help us be better at what we do. So without further ado, I'd like to introduce Dina Darlington, who is an advocacy relations professional with more than 25 years of experience in government and external affairs, patient advocacy, policy, reimbursement consulting, and other fields. Dina specializes in engaging patient advocacy organizations on access and policy issues, which includes a focus on health disparities for vulnerable patient populations. Deanna works closely with advocates on key policy issues that support dialogue and engagement to patient access to quality care and value, which we know is critical for our breast cancer survivors. For 13 years, Dina, I'm so sorry. Dina held various roles at Amgen that included policy and patient advocacy alliance development. She also served as director of reimbursement and policy at a number of other pharma companies. Before joining the biotech and pharmaceutical industry, she served as the first reimbursement specialist for the American Society of Clinical Oncology, where she staffed the clinical practice committee and developed the state affiliate program under the association's public policy arm. Ms. Darlington founded Links to Equity in 2021 after retiring from Amgen. She is the president and CEO of that organization, and she founded the company with the goal of serving patients and other healthcare stakeholders in all disease states and underrepresented communities such as Black, Latinx, Asian, Pacific Islander, aging, rural, LGBTQ, and others. She is a board member of Sisters Network Incorporated. We are so excited to have Ms. Darlington here today, who is the president and CEO of Links to Equity. Thank you so much for being here today.
Thank you, Kayleen, for that wonderful, kind, and warm introduction. I really appreciate it.
Yes.
I'd just like to thank Sisters again to this presentation for this warm invitation to present today. I'm excited about the topic. I think we're going to have a lot of fun and engaging new information about the digital age. So thank you all for having me and for the almost 30 years of what you've done for women with breast cancer. You're a blessing to the community. So thank you. And so can everyone see my deck right now?
I think you need to share your screen and start
Oh,
your
it's not
presentation.
sharing. Okay, sorry about that. I'm sorry about this, Kayleen. For
That's
some
okay.
reason, my deck isn't sharing. So do you guys mind if you, because for whatever reason, when
I
we,
think, let me see if we can have our technical person, Brigitte, pull up your.
oh, wait, I'm gonna just start over.
Do you have it?
Yeah, let me start over.
Okay.
Here it is. Good. Can everyone see it? It says that I'm sharing it.
Yeah, we can see it.
Okay, perfect. Thank you so much. Okay, thank you, everyone in the audience today for joining us today. I'm excited to share with you this discussion on the digital age. And the discussion today will really talk about advocacy, define that, because I think advocacy is one of those words that means a lot of things to different people. So we'll first define it and give ourselves some guardrails in the dialogue. We'll then look at some approaches we can take from a breast cancer perspective, and then key takeaways, and we'll finalize our discussion today with some Q&A. So to define advocacy for purposes of this discussion, advocacy is the act of supporting, defending, or arguing for a specific cause or issue with the real goal of bringing about change. And that change will occur through awareness, education, increasing the number of folks that's supporting us in order to influence the policy and make some real tangible change. So that's going to be our premise today as we talk about advocacy. The traditional tools that we've used, I think that Sisters is a great example of the first one, and that's really organizing and really building that grassroots base for membership and educating others and really pulling them together under one common cause. The second tool is that of education. And education, I think, is important from two realms. The first piece, obviously, is our members and our grassroots audience and our caregivers and family members, really providing them with the education that support our goals from a policy standpoint as it pertains to breast cancer. Also then taking that even further to stakeholders at a state and federal level, or those stakeholders that can influence and make real possible policy changes. Research is the third tool, and I think research is often overlooked. So I want to spend just a tiny bit of time kind of pointing out the importance of when we're going out to educate others about issues that are a concern to us or policy changes that we want to make. It's going to be real helpful for us to have some data and some information and research from a credible source that can really illustrate very clearly in a scientific way, what our concerns are, what the issues are that we want to make change in the breast cancer community. And then engaging in a regulatory agency. And I think for purposes of this discussion, a great example of a regulatory agency would be the Centers for Medicaid and Medicaid Services. They're the federal agency, largest payer of healthcare in the country, and they have regulations around what they pay for. So really trying to work with this regulatory agency or any agency that we're really targeting to get them to modify, change, incorporate policies that support what we're looking to advocate for. And then finally, lobbying that at the federal and state level, whether that's with your state legislature or at the federal level of Congress, and working with House members, Senate members to really educate them and try to bring them along and help them understand what we are advocating for in the breast cancer space. So those were the tools that's been there in place for quite some time. And then as we shift to this digital age, online presence, as Colleen mentioned earlier in her introduction, is so key right now. And I know that we are all aware of that. But I just can't stress the importance of social media and the sites, the various sites that we have to engage diverse stakeholders across the country, within our states, to really educate them and bring them along on issues that's important to us. Because as we saw in 2020, that social media, those social media sites can really bring about activism. And whether that's at an internet level, we know firsthand that that moves into an actual public awareness as well, this activism that these social media sites garner. But in addition, these social media sites can also play very important roles in our fundraising, building community, whether that's local, at a state level, at a federal level, educating individuals, lobbying. We know all of our members of Congress, state legislators, they all have Twitter accounts, Facebook accounts, Instagram accounts, and organizing. And we saw that loud and clear, again, back in 2020. So I'm going to move into this slide, and by a show of hands, can everyone show me if you're aware, if you're familiar with any of the folks that's on this this slide or any of the captions? So that number is steadily increasing in the audience, and that's because the reason, this is proof within itself that social media is really what elevated the voice and awareness at a social justice level with these individuals. We know that once Trayvon Martin was murdered, that was the beginning of hashtag Black Lives Matter. We know that Breonna Taylor was not on national media, but that grassroots work at through social media sites really brought her story to light. And I can go on and on about all of the various captions on this slide where we saw so much awareness around these individuals. Folks say, well, wait a minute. I think of health equity as really putting healthcare really at the level playing field for everyone. So everyone has true access to education, to quality care, to information. And that really is, it could be interpreted as a social justice issue, because really from the occurrences that happened in 2020 and that makes reference to this slide, that was social justice, but it was really about wanting just a level playing field. So I see that as, the events that kicked off in 2020, more and more stakeholders started saying, well, health equity is really important from a healthcare standpoint. And I bet a number of you can talk about maybe some inequities that occur from a breast cancer standpoint. And maybe everyone is not getting, well, we know everyone is not getting the same care and access to quality care, the same information, the same education. So I think that social media is an invaluable tool to apply to healthcare issues, especially those that pertain to health equity, because there's a clear audience there to take that information and run with it. I'll spend a quick amount of time on this slide. This slide really just illustrates the demographics of Black social media users. On my far right, you can see that quite a high percentage of Black social media users use the internet, use social media, are engaged. But I'm going to try to draw your attention to the middle of this chart. And what the middle really illustrates is that those ages 18 to 49 have the higher percentage of use in the Black community, Black social media community, I should say. So what that speaks to me is an opportunity to engage those younger users and employ them in our policy request, our mission, and really leverage their expertise in this space, their savviness, but also their engagement to bring others along and bring awareness to very important issues to the breast cancer community. The next slide, it really talks about how important the Black community views social media sites as an important place to discuss important issues for underrepresented groups. And in this slide, you can clearly see that people of color really have a much higher percentage of what they of a belief that social media is really the appropriate place and a great place to actually highlight important issues to them. And I think that, again, breast cancer is a very important issue, and engaging those members, those constituents in this space, I think is highly effective. Okay, so I talked a little bit about the opportunities we have with social media. Now I'd like to chat a little bit about a challenge that we have. Not everyone has the same access to technology. So there is this digital divide. Not everyone has the ability to go online and check into a webinar or be a part of a Zoom call. They may not have a data plan. They may not have internet. They may not be able to include their information in electronic health records so that hospitals or medical institutions can actually count their voice. And clearly their voice may not be counted in much of the social media activity that occurs. And from a medical standpoint, from a breast cancer standpoint. So I think this digital divide is extremely important issue and really represents a disparity. And I wanted to just put that, raise that to your attention so that as you look for potential issues that you may want to engage around from a breast cancer standpoint, I think this is a very key one. Just really trying to have a level playing ground where everyone can enjoy the fruits of this new wave of this new digital transformation. Okay, now I'd like to talk a little bit about sort of the approaches to patient advocacy. I sat in on last week's conference, so we talked a lot. I heard a lot of different issues at that conference, and I think that there's a lot of different opportunities for breast cancer survivors, patients, caregivers, family members to really have a voice in some of the issues, policy issues that they may want to lobby for, educate on. And I just wanted to share a few that I thought that kind of raised to the top for me. When I think about access to treatment and care, health equity is right at the top for me, because again, I don't think that we can honestly say that everyone has the same access to quality care, to treatment, to information. So I'm going to put health equity right there at the top. And obviously that can be also factored, that can be targeted towards breast cancer and looking at some of the inequities that exist. And then when it comes to a more broader field of access to treatment and care, I think that digital divide is going to be extremely important. I know that breast cancer screening is a huge issue. We all know that there's a delayed diagnosis, which interrupts or delays treatment. So we know that that's a huge issue. Also, the data to support genomics and personalized medicine for Black women. I think I remember hearing that last week as well. Very huge issue, because if personalized medicine and genomics is our future, then we're already starting not on that level playing field. We're behind because that data is based on studies and research that has already taken place. And if we were not a part of those clinical trials and that research, then there's a lack of ability to really provide personalized medicine or genomics for women of color. So I think that that's a real key issue as we look forward to innovation and treatments. And then obviously, broader issues around survivorship, health and fitness, psychosocial issues, clinical trial enrollment. We know that white men are the primary participants in clinical trials. And then one issue that I don't think that we talk enough about is this lifetime stress experiences. I would be very curious about the research that occurs and how that impacts our health and our treatment and the trajectory of our healthcare. So I think that that's another key area that I would love to see some more focus put around. So I'll move into partnerships, because obviously when we're advocating, whether that's at the digital level, whether that's at a more traditional level or a combination, partnership can be very good. My recommendation is that when there is partnership, that there is the ability to have clear goals within that partnership, and that it's mutually beneficial to everyone that's a part of that partnership. I think that that's one of the out of the gate sort of parameters that need to be put in place. But I do think that partnering can be a very good opportunity, because you really expand that tent and you're able to bring more voices along with you. And it may not necessarily have to be partnership with, say, a breast cancer organization. It could be partnership with a caregiving organization. It's just as long as there's that mutual alignment, mutual goals, and that's really set out from the start. And then there's an array of issues with those partners that will provide the ability to partner on one or more issues and really bring a stronger voice on your advocacy journey. Okay, so interventions and this opportunities to apply these digital interventions. I talked about partnerships, but I talked about mutual alignment and priorities, but I think that value partnerships are also very important from an advocacy standpoint. Like I said, I think it's always nice to add additional voices, but I think it's also important to understand the value of that partnership and what that partner brings to you. Since it's going to be mutually beneficial, I think ensuring that it brings value to your organization or to the goal that you're trying to accomplish at a policy level. So a great example of that could be also ensuring that if one partner is out to do some research or to do a survey, there's that data that we talked about on the first slide. If we have that data to take to whether it's state legislators, federal legislators, and really demonstrate and from policies that or the problem that we would like to solve, I think that's huge. So some partnerships can provide us with that data. But again, I think these need to be really clear goals from the onset and identified. And I think another opportunity here is to understand what policy or data I would like to see and have a voice into what is being collected and what's the outcome of that. What will that data show and represent? I think having a voice in that process with a partner would be super beneficial. And then as I mentioned, really unifying, potentially going across different diseases outside of cancer. There may be this common goal that would allow you to gain additional support, because at the end of the day, when you are, advocating, you need support. You have to, the more voices you have, the better. So I'm a huge advocate and fan of tying in others to support the goal that you're trying to accomplish at a policy level. And just for some quick takeaways from this meeting, I'm running a little behind, so I'll go through this really quickly. I think that it's super important to engage younger folks and bring them into the work that you're doing, into the advocacy space. Also expanding that reach, that stakeholder reach, creating a space to reach traditional media outlets by working through that social media outlet. And as Kayleen mentioned earlier on, right now, the environment of COVID supports this digital environment. We're able to do a ton of things virtually. So really embracing that and looking for, when forming relationships, making sure those relationships bring value to your organization and not forgetting the importance of data. So with that, I will pause and happy to answer any questions.
Yeah. Well, thank you, Dina. This was really right on time, actually, given that we're just coming off the heels of our town hall that we had a couple of weeks ago, and knowing that moving forward, what our plans are with our task force. I will say that when you touched on partnerships, I do wholeheartedly believe that partnerships are critical when you're advocating, um, um, especially on a large scale where you really want to take action and move the needle. And so that was very important to, just to the organization when we hosted the town hall, because we brought in partners that were the links, for example, the Links Incorporated, Sigma Gamma Rho Incorporated, the HBCUs, Spelman Alumni Association, Howard University Alumni Association, TSU Alumni Association, Top Ladies of Distinction Incorporated. And so we found that to be mutually valuable, because a lot of them have, initiatives that support a common goal of ours. But it just helped us expand our footprint out of some of the more of a non-traditional space to get to introduce sisters, as well as to engage their core groups to participate in our call to action on the breast cancer crisis. And we know moving forward, we will continue to bring in additional partners, because you're right, it only amplifies your voice, and you can't do it alone when you're trying to take action on something significant, whether it's breast cancer related or another advocacy issue that's important to you. So one of the questions, and if anyone has any questions, please put them in the Q&A section, and we'll definitely share them with Ms. Darlington. But when you're looking at legislators, what would you say are some of the key to do and not to do things that, just as a baseline for organizations like Sisters, or even if someone's wanting to advocate for something, I don't know if they can do that individually, but what kind of suggestion would you give?
Sure. I think that having an annual fly-in every year, identifying, being an organization with women of color, we have the Congressional Black Caucus, who would be ideal to tap into and to visit during this time period, make them aware of your policy priorities. But I think also recognizing the chapters that sisters have. You all could, just spend a week on the Hill with the various legislators, and don't restrict that.
Okay.
Right.
Yeah, and I thank you for bringing up our chapters. And if any of our chapter members are on, please, let us know that you're here. Our chapters are very important, and that's what makes Sisters so unique compared to some other organizations that are out there doing some good work, is that we do have those women in the respective communities around the country. And so that lets us expand our footprint in a different way. And so we are very, very grateful for the work that they continue to do.
And really give them an opportunity to come in and bring their voices across these and talk to those legislators, because if everyone is talking to their legislators from different states, that's going to bring us a groundswell. So I think that having that diverse discussion, and then couple that with the members of the Congressional Black Caucus, would be even, the icing on the cake in that scenario. So I think that that's a great to do, an annual fly-in where, sisters have identified key, or you can't all go, but identifying key groups to go on and speak, and have a predetermined list of folks that you're going to visit with for a day or two, I think would be, and that I mentioned later in the presentation, is that of data. Having that evidence that supports the policy positions that you're advocating for. I think that that's huge as well. And I think, so I think that from a congressional standpoint, to not be prepared, to not be organized, have those hearing those patient voices, hearing those patient stories in the member's office during those visits. I think it's very compelling. And just really driving that home, having a well-oiled machine where, all the visits are set up, that occurs. It's a lot of planning, it's a lot of work, but I think it's a great payoff. And I think that the voices really need to be heard. And I think that, there's breast cancer issues, and then there's women of color breast cancer issues that I think does not get communicated as often as they should. So really, sharing that information as well. And if possible, working with a regulatory, a federal agency, whether it's the, HHS has the Office of Health Disparities, and really maybe doing a partnership with them prior to that meeting to prep as to this is what this office is doing, and here's some changes we want to make, and we want to lobby for some money to be moved over there around these changes.
Okay. So someone put in the chat a question, are you looking to partner with corporations? If so, in what ways? So I'm assuming that question is that for me, Ms. Moore? I'm thinking that question might be for me. We're always looking for corporations that can partner with us in terms of from financial support, from resources, from helping us get our word out.
Think about policy.
Policy too. The policy.
They all have lobbyists,
Okay, right. So I mean, it's a several pronged opportunity in terms of working with corporations, and so I know as an organization that's something that we are going to be very heavy moving forward into 2022. Of course, action and awareness and outreach and engagement are always going to be at the core, but we are looking at, from an action standpoint, where can we make some tangible, real change to change the statistics and the numbers that our Black women are currently experiencing when it comes to breast cancer, because we know that there is a crisis and is a problem. And so we've got to take it to the next level. I just want to point out, thank you to our Austin chapter for being present, and members of our greater Detroit chapter. We have some wonderful sisters around the country, and so I thank these two chapters for letting me know that you're on the call today. And we also have someone who's inquired about hosting a chapter, potentially starting a chapter in the U.S. Virgin Islands. We would be happy to talk to you. There is a section on our website where it says chapters. You click there and there'll be information about that process. We would welcome to have a conversation with you, but we can't have enough chapters around the country. Trust me, we need all the boots on the ground to mobilize, to save lives. When we talk about advocacy, do you think that having, you talked about, I guess maybe breaking it up in different sections of what you're advocating for. So maybe it's, with the mammogram, looking at the guidelines to be lower, and then maybe there's another section. So being very targeted, is that what you're suggesting?
I think targeted in your ask, what it is that you're, looking for, and getting that input to see. Because it's going to shift, just like we see what's going on right now with legislation and all the sausage making. So it will shift. But I think that you're dead right, that if you can be very targeted, what it is that you're looking for, who can impact that, because I think that those stakeholders would then broaden. I don't think that legislators are the only, I think that that's great. But I think that also when we look at regulatory, we would only have really one area to go to, and that would be HHS, because I think that we're looking to lower that age. And Medicare, Centers for Medicare and Medicaid Services, they're only focused on those folks 65 and older. So certainly still educating and making those members of Congress aware, but I think expanding that stakeholder. Employers is a great organization to lobby and to educate. Payers, great organization to lobby and to educate, and maintaining that dialogue at the federal level so that they, the legislators, they are aware of your issues. And I think that makes others' ears kind of perk up, because You're communicating that message at a federal and state level, and you're asking them to engage with you.
Okay, I have a question / comment that I'd like to share with you. It says, I have found it difficult to hear any information about stage 4 or metastatic breast cancer in the breast cancer initiatives across the board in the breast cancer community. How can more breast health organizations inform the public at large and sisters in particular out of this issue? I am metastatic myself, did not understand the depths of METs and reoccurrences when initially diagnosed at an early stage in 2024. Let me just first say that you're very correct, and thank you for saying that there needs to be more communication work, advocacy regarding metastatic breast cancer, and Sisters Network included. That's something that's actually on the discussion for us to do some different things when it in the metastatic breast cancer arena. We have not that we've ignored it, but we have not elevated it as much as we should and could, and we intend to. So thank you for bringing that particular topic to the forefront, because it is important. And we do have a disproportionate number of Black women with metastatic breast cancer. So can you lend any kind of comment to what she's talking about with metastatic breast cancer and advocacy?
What I think would be wonderful is to partner with a, and I'm not saying sisters need to do that. This is just, in general.
Yeah, in general, yes.
Communicating with a, whether it's a cancer center, and asking that you want this. If there's relationships with particular physicians within a cancer center or an advocacy department within a cancer center, and really elevating and telling them. If there's an industry partner, which I would think that there would be, that is motivated to develop these materials. I think that and really having, I think that Sisters is in a great position because of the relationships with the industry and whatnot. But just passing that information along, or if there's an opportunity for them to support something like that, I think that's one of those mutual beneficial relationships that I talked about. Mm-hmm. That where, we want this information and we need to be funded to develop this information, and very clear. And we draft this information, Right. So, that way you own the language. It's going to help your membership and your partners within Sisters. And it's not their spin on it, it's your information. And what your patient populations would like. So I see that as a great opportunity to leverage and tap into some of those mutually beneficial relationships on the industry side, as well as on the cancer center or physician side. Okay. But even nurses too, they're great organizations. Right. ONS, Oncology Nurse Service. And what I found is that a lot of these organizations are wanting to do stuff that support communities of color. And there's some that maybe just have lip service, but I would absolutely tap into those that have a desire to really engage on these issues that impact women of color.
Okay. We have a question. Is anyone working on prevention? I am a prevention advocate and believe that is the real problem. Do you want to take that?
There are organizations that does work on prevention. And I think that again comes to that partnership with other organizations. There's I know Prevent Cancer is an organization that's out there. So I think that, and it may be an opportunity to say, hey, I'm very interested in Prevent Cancer, and we want to target and focus on women of color or Black women. Do you have partnerships that can help us with this. And then there's a partnership in drafting that and identifying what type of information is actually going to be shared. I am such a huge fan, and that's why I included in the deck, of partnerships. It really does work. And I think that we're in silos a lot, and we don't have the ability, or, you know, even who do I contact? But I am a huge connector and a believer in partnerships.
Okay, I just want to give a shout out to our national president, our Nashville president, Doris McLay is on the session today. And so we thank you for your leadership and as well as your participation today. Again, as I said, our chapters, our members, Sharon Crowder out of Austin chapter, you know, again, the boots on the ground are going to be critical for how Sisters continues to moving into 2022. And you know, on more of the advocacy side of things. Again, awareness, engagement, and outreach are going to be still at the core of who we are, and support, of course, is definitely going to be who we are. But again, that call to action, we were very serious about it on October 16th. It was meant to set the stage for what is to come as an organization as we move into, you know, this next chapter of the organization. As you mentioned, we've been around nearly 30 years and have done a phenomenal job in our footprint and the support and all that we have done throughout the country. But we're frustrated. We're frustrated with the statistics not being what they need to be, what they should be, and what they can be. And so it's time for a change, and who better to call that out, and who more comfortable to call it out than Sisters Network, because we are the leader in the Black breast cancer movement. So we felt it was our responsibility. And so we will be collectively asking those corporations, those organizations, those grassroots community groups to join in our voice so that we are one voice, one action when it comes to beating Black breast cancer from an advocacy standpoint. It's going to be critically important. Here's a question. Have you done any breast cancer awareness for high school students similar to what First Lady Jill Biden in Delaware over 20 years ago? I'll make mention, we've had a program called Teens for Pink, and it's a wonderful program where it basically educates young girls ages, I believe, 12 to 18 regarding their breast health. And they take a survey and they survey the women in their family, mothers, grandmothers, aunts, and any women important. And the whole goal of that program, which we are reintroducing in 2022, we have a lot of things that are coming back in 2022 that are being repurposed or relaunched. It will be digital though this time for the kids, with the young girls. But anyway, they will ask some breast health, very poignant breast health questions to learn about their family history. But at the same time, it's kind of poking those women. If they haven't had their mammogram, they're going to be asked about it. And then the young girl's next question is going to be, why haven't you had it? Do we have a family history? And so why wouldn't you do this? So the goal is to educate the young woman, but also to push along that important woman in their life. If they aren't making their health a top priority when it comes to breast health, they will, because now you have someone who's important to you, who's a young girl. So yes, we do have a breast cancer awareness program for young girls. It's high school, middle school and high school level, and they earn community service hours, which is important when they're doing their college apps. And we, award them certificates of completion of the program. So look out for Teens for Pink. It's an excellent program, and we're excited to bring it back. We have another, let's see. I have worked with many breast health organizations during the 7 years I've been metastatic. Many initiatives have been started, but fall short due to lack of participation with Black women. How do we engage our targeted market of Black women when many keep silent about their personal health issues and don't trust the healthcare industry? And this is again regarding metastatic. There's a lot of work to do because you're right, metastatic has not been out there as much as it should be in terms of discussion and awareness and engagement. And I know Sheila has been very supportive of Sisters Network in sharing her story and I know she's very active on the Hill doing a lot of things. So we will be calling you, Sheila, to help us understand what some of the things you can help us to understand to do differently to make a difference in that kind of conversation, because metastatic is an issue, it's a problem, and we do need to all do better, not just Sisters Network, but the industry as a whole. We all have to do better on that. Deanna, do you have any comments?
Yeah, I agree with what you said, and I totally am aligned with what the participant that typed that question. It's challenging. It's really challenging to not have that engagement at the community level, meaning the actual the patient engagement. I'm blessed to be here in DC, and we have a local breast cancer fund, Thelma Jones, and she's amazing. And she's been very successful in keeping that tight knit patients. And they work with Lombardi Cancer Center. And I think, but I also have a family member, my husband's aunt, who just totally dismisses that she is metastatic, but she totally dismisses it. So there, I get the issue that you're talking about, and my only thought is we have to destigma. We have to take away that stigma and that fear of just talking about it. And I'm a huge fan of wanting to work on a project where we can tell our mother's stories. I think even Karen and I may have even talked about this at some point, where we tell our moms, the whole family of women, just, we have to be open to telling our story. And it's bigger than all of us, I think, right Absolutely. Now. But I certainly think that we shouldn't lose sight of it. That was a great question.
Yeah, and our slogan, one of our slogans is "Stop the silence," so we can start beating the odds. Because silence is, and again, it's not just about breast cancer, but it's a problem culturally within the Black community, not sharing family history or talking about things that are that are health challenges, major health challenges. Sometimes we don't share as much as we should. So we're looking forward to working with everyone. I see someone, Ms. Early, who's out of the state of Washington, says she's ready to get started with advocacy. Well, we will be contacting you so that you can help us, because again, we can't do it alone. We know that, and we're not interested in trying to do it alone. This, like you said, Dina, this is bigger than Sisters, it's bigger than all of us, but we can do what we need to do. And I'm glad, Sheila, that you like Stop the Silence, because silence is what we've got to stop. And so Mrs. Jackson coined that, as one of our signature slogans, Stop the Silence, so that we can start beating the odds. And that's what we intend to do. We're going to put up a poll while we're finishing up. We'll take one or two more questions. And Dina, if you have any, closing comments that you want to make while folks are taking the poll, please take the poll. It just takes a couple of minutes. I really would appreciate it. Engagement, advocacy, and action for me are the core of what we need to be doing. It's just that simple. And so where we're strong, we can continue to do those things, but where we need to beef it up, we intend to do so.
Well, my close, I have one small closing comment, and that is in regard to that. You triggered some thoughts as you were talking about that last comment, and it could be an opportunity for a campaign. We talked about social media in this deck a lot. And I mean, it's powerful. When I didn't go through the stats because I wanted us to kind of have time for Q&A, but the number of followers and hashtags that come up are just, it's astonishing how powerful social media is. So with that in mind, and this issue that's bigger than all of us, potentially a social media campaign
Absolutely.
of sharing, encouraging us as Black women to share our history. And we can talk about this and get into the weeds on another discussion, but I think that's a great project to kind of focus on for whether it's 2022. I'm not
Right.
trying to
No,
put work on
absolutely.
anybody's plate, but
And I, it's funny you mentioned that because we just had a meeting with a corporate partner the other day, and we talked about a campaign, and we're actually going to be scheduling a brainstorming session because they were very much interested in it, and they were very much supportive of the town hall, and so they were excited about the next steps. And that was one of the things that I said, that we do have to have some sort of campaign along with some of the work, because they all work together. Just before we kind of get ready to sign off in a couple of minutes, do you think that the digital, and we know digital outreach and stuff is not going away. When you talked about that divide, and particularly, we have a divide in our community, in Black and brown communities, unfortunately, what is something that we all can do to offset that divide, to make sure that we're still getting to those people? Because we can't make the assumption everybody's going to be able to get on a Zoom on a Saturday, or log in onto the website. And so that's why we're really anxious to get back out there with our chapters and get back to some of that, being entrenched in the community, because we love this engagement of the digital stuff, but we still know that our core is about the touching, feeling, sisterhood, support, camaraderie. And that's how we get people excited and mobilized.
yeah, I think that the way to, I think that, this legislation that's coming out right now, I believe there's some infrastructure around this. This is a huge issue. I think that once, we begin to look at what policy priorities are, I think this is a lovely issue to our voices, for all of our voices to be raised about, if we're going to do any lobbying around, health equity. This is key and instrumental. And I think it's, it certainly can have a breast cancer lens, but I think it's from a communities of color standpoint, we have to, and then also, so that's just information sharing, which we know is important, but also what about data? These women are not getting their data included in broader research. And that's, that leads to this whole problem about genomics, personalized medicine, having our, I have my electronic health record where I can just pop up and look to see what's going on. That's not the case for a lot of women. So I think, and it impacts us more than at information sharing, which is key, absolutely key. But it's even bigger than that. So I think it's a prime issue to advocate on, and also to partner with other groups. I mean, again, remember we talk about, let's just figure out who we want to partner with on this. And I think that's going to be really helpful too, because there's other folks. This is an easy ask. If you're going to do a letter or whatever you may be doing from a lobbying effort, other groups will come along on this for sure. Because you have rural communities, that's a great partner. The rural communities.
Yes.
That's a great partner.
Right. Just a couple of little housekeeping notes. November 1, which is Monday? I can't believe we're already talking about November. That is the last day for our National Mammogram Program. Please share the information with us and with your stakeholders and friends and neighbors. We are paying for mammograms for women across the country. The application is on our website. We really want to get these mammograms that were not done in 2020. Let's not skip another year. We're here to help. Please have ladies to apply. Yes, that includes US Virgin Islands. Please apply. November 1, application is on the website to download. Well, you don't even have to download it. It's a fillable PDF, save it, and then email it. Just get it in by November 1. You'll have until November 30th to get your mammogram done and paid for. The program's been open for a little bit for a while. Anyway, we are very excited to have Ms. Darlington on our board. She is new to the board. I think you're coming at a critical time and a crossroad for the organization. And so we really, really appreciate your time today, just sharing some insight about how to engage the Black community in this digital age, and how we continue to build on advocacy to support what we're doing with Sisters Network. It says I finished my survey, but it will not submit. Somebody's okay. We're having a little technical difficulty, and I apologize. Let's see. I'm an advocate on my own passion. Have a YouTube channel and working on more. See my YouTube channel. Prevention is the real cure. Okay, good. This is great. We'll check you out. Thank you, Deanna. Dina, do you have any last parting words?
I just want to say thank you so much for the participants on the call. I appreciate your time today. And I'd also just like to reiterate my thanks to Sisters Network for the amazing work that they're doing in the breast cancer space. And I just encourage all of us to continue with engaging at that grassroots level and elevating the voice a bit higher. And I'm happy to be a part of that and to support that.
Okay, we again thank our chapters for being on board. We thank Ms. Darlington for taking time to be our presenter today. Pfizer, Seagen, and ASI, we thank you so much. And following National's Footsteps, Sisters Network Greater Detroit chapter also has a teen program on Power in Knowledge, PINK. It's designed for girls 12 to 18 years old. So folks, if you want to learn more about that, check out our Detroit chapter, Cecilia Pope. Just put that in the chat. We want everybody to stay well and continue to make your health a top priority. Sisters Network has been here for nearly 30 years and we aren't going anywhere. And we look forward to continuing to serve Black women around the country who need us to be the voice. And we're happy to be there. Thank you so much and all be blessed. Thank you.
Thank you.